Walk me through how you define longevity.
How do I define longevity? Well, it's really interesting coming from an indigenous population. So I'm from an indigenous population from a first world country. But what you find around the world is that most indigenous people suffer the greater burden of illness and disease and the same bell curve of disaffectedness. And so longevity is a really interesting topic when it comes to us because most of our people die really early. So longevity means that we're doing something right. If we're doing the things that we need to do in terms of healthcare and health service delivery, but not only that in terms of well-being and the creation of well-being, if Indigenous populations are thriving and indeed living longer. What I've really heard is, this is obviously clearly a health space and not necessarily a public health space, but what I'm hearing is a lot more around the inclusion of the determinants of health within healthcare service delivery, within the understanding of what it is that Abu Dhabi Health wants to really highlight in terms of a holistic approach to health and well-being. And that's really encouraging because for a long time that's been missing when we think about primary care service delivery and health service delivery.
Industry methods, industry outlook, if you will, equity in healthcare. How big of a challenge is that globally?
It's a huge challenge because actually what we're really looking at when we talk about industry, whether it be healthcare industry or, anything that's related to that, or just generally, commercial determinants of health are a real area that we need to understand and make sure that we are living our responsibilities as a global population to how we understand the financial imperative in terms of how we operate business. And so how are they operating? Are they operating from a value standpoint, from a well-being standpoint, or are they operating from that what we know to be long-term typical financial imperative? So if we can switch the way in which we understand business and therefore address the determinants of health that are negative in regards to these things when we talk about industry, then we'll be winning.
Lots of conversation around the possibilities that AI brings us. How do you see artificial intelligence in this space?
Yeah, I think it has a lot of use in terms of being able to be quicker, faster, more effective in terms of the delivery of things, the capturing of information to be able to create new things and to address impending issues. However, we do need to be really mindful that it isn't the be-all and end-all, and that in many ways what it's doing is it's removing from us the ability to have relationship with one another. And for me, in terms of how we address equity, is really about the relationships that we have with each other, and therefore the tools that we create in those relationships that value the relationship and value the humanity in addressing and creating good well-being.
Next big health crisis, a pandemic?
What, quite possibly, but I think there's probably something ahead of that, which we don't know what that is, and I hesitate to put a word on it right now, but in regards to political implosion globally, I would say we're probably heading for something that's much more quickly going to affect us of that nature, which will then also affect what happens when we have a next pandemic, but there's always another pandemic coming.
And in terms of longevity, a big part of that has to be how we address mental health.
Absolutely, absolutely. And so there's this whole thing in regards to equity, right? Equity can only happen if people's minds and decisions are able to be in the best place possible to get the best outcome. And so when we think about mental health at all levels, without good mental health, we don't have good decisions, we don't have happy, healthy, thriving populations. And so ultimately, prioritising mental health is absolute key to all health equity.
Tell me, how does a community be its own best advocate?
Again, it does. It's really about how much we're communicating with one another and how much time we spend with one another. It's really interesting when crisis happens, communities come together and they really lean into one another and support one another. But when we're in between crisis points, that's when, the energy falls off in terms of that staying together. So what I would want to see is people leaning back into, that community way of living, that collective responsibility for one another in the spaces where it's not just crisis, but in the normal everyday way in which we socialise and behave.
How does Abu Dhabi play a role there, do you think, as that bridge and conduit?
Yeah, I think there's a really interesting situation going on here in Abu Dhabi and indeed the UAE. An opportunity for leadership too, I think, in terms of it really reimagining itself and understanding itself in the contemporary context of what it is to be a nation of this kind, and how to bring that sense of community and family structure into sort of a more highlighted platform so the rest of the world can really see and understand that. I mean, there are other communities like this around the rest of the world that operate this way. And if we can all together show, the Western perspective, what the benefits and the value is in terms of that family structure, community structure way of being as a society, then I think we'd be winning, and there are huge opportunities here for leadership in a number of ways.
Thank you for joining Abu Dhabi Global Health Week.